All right, let's discuss this together. Are you aware that in Nigeria, out-of-pocket health payments have a significant impact on the poverty levels? A study published by the International Journal for Equity in Health found out that out-of-pocket health payments led to about 0.8% increase in the poverty headcount, pushing approximately 1.3 million Nigerians below the poverty line. Additionally, Nigeria is one of the 3 countries where out-of-pocket health spend exceeds 70% of the current health spending. This calls for concern. Should you, as a financially intelligent parent, be involved or be part of the numbers of people who are paying so much out of pocket for health services? Let's discuss it on the other side. See you there.
Waking up at dawnlight, breaking through, chasing dreams, no time to lose. In this race we strive and grind, motivation fuels the mind. Gonna rise up, we won't fall, breaking barriers through it all. Step by step our journey's clear, success is closer, don't you fear. Challenges we face headstrong, in this rhythm we belong. Skies are high, but so are we, building castles where we're free. Gonna rise up, we won't fall.
All right, welcome back. I want to say a big thank you to every one of us that has joined on the call, and I celebrate you because you are always showing up. Thank you very much. And for those persons that are just joining, I want to say you're welcome, and we want to advise that you kindly click on the subscribe button and the like button so that this will help you watch the previous episode. We started this some couple of days ago, and it's about 90 series on financial intelligence for smart parents. And this is one of it. At the beginning, we talked about goal setting for financial intelligent parents. We've talked about money. We've talked about vision, goal setting. We've talked about budgeting and so many like that. That if you go into the channel, the name of the channel is at Success and Harmony 247. On that place, just go to the live session. You'll see a lot of the videos and things that we have done in that so far. And I know they are going to be of great benefit to you. So let's go into today's topic. It's a simple one. We're going to make it as fast and short as possible. But then it's something that you should pay attention to. Now, talking about health, they say health is wealth. When we're talking about some of the assets that you need to have, that one of the critical assets you need to have is your health. So where health is concerned, you must pay attention to it. But now we are not even talking about the health. We are talking about the expenses. You know, when you give yourself a target, when you give yourself a goal that this is what you want to achieve as your savings, what you want to save over a period of time, and then suddenly you need to pay some emergency medical bills that you didn't even plan for, maybe for your parents, for someone, for a loved one, and something like that. And then you now go to empty everything that you have saved for how many years? Of course, when health is concerned, every other thing comes to a kind of standstill. It shouldn't be like that. What can we do? And there are provisions that are set already for this, but many of us ignore it. I remember whilst at the early stage when we were my wife and I, we were having our children, because we enjoyed a program called NHIS, that's the National Health Insurance Scheme. We paid very little or nothing for the birth of the children, for the delivery of the children, even though we used very expensive hospitals. I want to give you just something that happened recently, some couple of months ago. A very good friend of mine has a brother who was about to go for, the brother just came to meet him that the wife is pregnant and that he should assist them and so and so. He said, okay, how long is the pregnancy? He says about 4 months. He said, okay, quickly, I want you to do something. Go and register for the National Health Insurance Service. And then the guy went. I think he had to give him the money also to go do it. I think. Because if he does not do it, when the delivery time comes, the same man will come to meet him for assistance. So he gave him the money, and the guy went. Just how much? The registration fee, very minimal amount, about 15,000 naira or thereabout. So, but when the day of delivery came, fortunately or unfortunately, whichever one we want to say, thank God for good delivery, the woman gave birth through cesarean operation. And that would have ordinarily cost about 400,000 naira. But this man went into that hospital with his wife, and they had a safe delivery for their baby, and they paid nothing apart from maybe about 10% of the cost of the drugs administered. Who could have said it? Now, if that man was not informed about the national health, as at the time that woman was going for the operation, they would have called him and he would have joined them in running around to raise funds for this. So health insurance cannot be overemphasized for you that you are a financially intelligent person. These are some of the things that you are going to do to safeguard your wealth, to safeguard your savings over a period of time. Now, let's talk about the National Health Insurance Scheme. What in the layman terms, what it just means is this organization, they help you when it comes to medical issues. Now, this is not something that we formed yesterday. This is a federal government. For those of us in Nigeria, is a program of the federal government of Nigeria, which is open to everyone. Presently, people that are working in corporate organizations, government ministries, and so on, most of them enjoy this service. But we've come to see that most persons that don't benefit from it well are the self-employed persons. Self-employed persons, a lot of them don't even know that this thing is existing. I remember going to do a talk with some group of Okada riders, and I was telling them that, do they know that this thing exists? They said, no, it's not possible. And I said, yes, it is. If it's not possible, we will be talking to you about it. So, one, people that are self-employed, most of them don't know about this program. Now, also, people that have, maybe you are under the program and you have children that are above 18. Once you have a child that is above 18, that insurance does not cover that child. That child has to be independently registered. Now, it used to be NHIS, that's National Health Insurance Scheme. But now, because the spread has been widened, it is now called National Health Insurance Authority. Under the authority, it is mandated that every child, once the child is 2 weeks old, that child should be registered for the National Health Insurance Authority program to enjoy a wide range of medical services. It will not be good that at the time of a medical emergency, that's when parents or children will not be running helter-skelter. So this scheme this program is something that you and I should pay attention to. Even if you think you don't really need it, there are people around you that do need it. There are people in your church, there are people in your religious organization, there are people in your offices that actually need this. How about your neighbor? How about your uncle? How about your dad? Those people that you are responsible for, they will need health services at one point in time or the other. So the importance cannot be overemphasized. So one, critically, it will just prevent what health insurance will do for you is that it will prevent that out-of-pocket medical expense. You go to the hospital, you see somebody get to the hospital, he has to pay for card. After paying for the card, he has to pay consultation. As we are speaking, about 10,000 is gone already, even before they start administering anything. Now, also what it does is that it guarantees treatment in case of medical emergency. There are some hospitals that when people get to, they will tell them, you need to pay so much amount down before we can even treat you. That's not the case when it comes to the people that are registered with the NHIA. So it safeguards family savings in case of these unexpected medical expenses. What it also does is that it gives a kind of peace of mind. You can imagine the man is not around, he has his family somewhere, but he has registered them with this with the NHIA. If there's any medical emergency or need for any medical services, he can just easily tell the spouse, take the children take that fellow to that particular place, let them go enjoy that facility. So, having said that, let's look at what is NHIA itself. NHIA is the full name is National Health Insurance Authority. Now, it is established to provide universal health coverage to Nigerians. It has a legal framework and it is established by the government. Now, the government is doing everything it can to make a lot of persons to be informed about this service. But unfortunately, I don't know why. Bad news spreads faster than good news. But this should be good news for everyone. I met a young lady one time. I was having a program, and the young lady, I just saw her with a baby. I said, congratulations. Hope that kind of those pleasantries and everything. Then in the course of the training, I was asking her, hope you have an insurance. She said, what was the insurance about? I said, how much did you pay for this delivery? She said she paid about 80,000 naira. That was a normal delivery. And I just imagine, physically looking at them, this is somebody that actually needs help. He needs help. You understand what I mean? It's somebody that, I don't want to say it's somebody that is, not financially capable as at that moment. And I just imagine that 80,000 will have done a lot of things for them and their family. But here they had to cough that amount out to pay for this. So at times you pay for ignorance. A lot of persons are paying for ignorance. All right. So what is the coverage of this National Health Insurance Authority? One, it covers both public and private sectors employees, whether you are working in the private sector, you are working in the public sector, wherever you are, this scheme covers you. And expanding coverage to informal sector workers and vulnerable population, nationwide network with accredited healthcare providers. A lot of healthcare providers are already using this. So most of the time you get there, some of them might not know, but I think a lot of hospitals are now getting this information and they are registering and onboarding people in the service. So what the key features of the scheme, apart from the fact that I would say it is cost effective, it also has an inclusion of pre-existing conditions. What we mean is that somebody has been sick, because when you go to some health insurance services, they will tell you if the person has some underlying thing, they are not going to underwrite the person. But with this one, even when the person has been diagnosed of any disease, the system still onboards that person. And after the period of wait, because there's a registration, when you register on the scheme, it takes about 90 days for them to profile you. Once you are profiled, you begin to enjoy the health benefit. So it covers you, for your family. You can register as many persons as you want to. So now let's look at the other side. We want to quickly look at is what are the things that this NHIA covers. When we're talking about the things that it covers, what are they? Because you hear a lot of persons will tell you, no, it does not, they don't take care of this, they don't take care of that. If you have not experienced it, I think it's good that you pay attention and then you get the right information as to what it covers. I'm going to share with you quickly. Let's share a screen quickly to see what that this thing can cover. The National Health Insurance Scheme, the NHIA Giftship Benefit Package. The package, it takes care, it has what we call the specialties and services under the NHIA. We have the primary health care, general surgery, internal medicine, O&G, pharmacy, laboratory, pediatric, radiology, dental services, psychiatry services, orthopedic, physiotherapy, and you know all the GGGGs that you have there. We have a comprehensive training on how and what this service covers. So it takes care of primary health care, it takes care of the primary care level and secondary care level and the tertiary care level. So these three sessions, you know, why do they categorize them? You know, there are some health challenges, somebody is having malaria, and this, that is under the primary care level. Then we go to the levels of the secondary care where they have to do some more, you know, a higher level of things. But what we're trying to say is that all these things are already taken care of by this scheme. You don't have to pay anything as far as this thing is concerned, as far as this service is concerned. The only thing that you might be paying is the 10% of the cost of the drugs that will be administered to that fellow. All right. Now let's come back. The purpose of this training is not to begin to tell us what's NHIA. Here we are talking of financially intelligent parent. That's what we are talking about. So how does this relate to you as a financially intelligent person? It now tells you that no matter what, if you are planning your medical service, you are doing your budget in the course of the year. Let's say you sit down with your family, you are drawing your budget for the year. You should always budget for that medical health insurance. You may never use it. Of course, most of us that use cars, most of the persons that use cars, you pay for insurance. At times you never use that insurance in the course of the year, but it is there. If you remember to use it when the time happens anyway. But that is there and it is there. So you do it. Medical emergencies will not announce themselves that they are coming, but they do often happen. So you prepare. Part of your medical, part of your expense for the year should be your medical expense. Always put that in mind. So ladies and gentlemen, when you are able to do this, it will create and give you a lot of saving. Please don't go with the crowd. You know, some persons will tell you this thing, you know, there are some things it covers, there are some things that it does not cover. You get there first. You go complain and say, do you know that even up to this collection of glasses, it covers. The only one time it does not cover is when you are trying to get, you know, some designer frames and everything. You know that dental services is covered according to just what I just showed you. And these are some of the things that, please, you need to get informed about this, and it is not expensive. So what we have done in our own organization, in the RICHVISION Cooperative Organization, is to help our members, because one of the things that people say, it is expensive, the process of registering and everything is cumbersome. No, it is not. What we have done for our members is, as a member of the RICHVISION Cooperative, the Financial Intelligence Network, once you're part of the Financial Intelligence Network, what you do, you fill the form. Once you fill the form, scan it to us with your passport and things, and we'll take it up from there. So, and some of the things that we even do, we pay for some of our members, we even go ahead to pay for them if they can't pay the amount in bulk initially. So that we don't want a situation where in our organization we'll be saying, let's gather money to go. God forbid, we don't pray for that. So, but for us to forbid it, let's take the right action. I hope you're getting something. If you are getting something of this call, can you just in the comment section type value? I want you to just put it there, value. Now, this thing covers you. It does not matter where you are, as long as you are in the territorial environment called Nigeria. You understand? So, as it doesn't matter, you could register in Lagos and get treatment in Kano and things like that. So, you should pay attention to it. So as a concern for Financial Coaches Network, we want every member, and as you are listening to, I want you to get registered on that NHIA. You think maybe I'm working for them. I'm not working for them. I'm just an advocate of financial intelligence. And I just believe that this is financial intelligence to help you manage your medical expenses. So ladies and gentlemen, that is much I want to talk to you about. This has tremendous benefit, and I'm going to put down the link to the full presentation where you can watch the presentation that was done on this program. You're going to watch it there and get all the necessary information that you need. I put the link in the description section of this video. Go and watch it and get the best for yourself. So, ladies and gentlemen, you've been listening to me, you've been watching, you've been getting value. Why will you just watch without even subscribing? We need you to click the subscribe. Just check under there, you see subscribe. Well, now, what does subscribe do for you? When you click on the subscribe button, it helps you to get information when the next video, when the next training will be coming up. And then also, we need you to help us share this information to get other people to subscribe. Our target is to get to 1,000 subscribers. Thank you for as many persons that has helped us. We are over just a little bit above 200 now. Can we make it 1,000 persons subscribe on our platform? Our target is to reach over 1 million persons in Nigeria, but it takes commitment of you and I to get this done. So like the comment, like this video so that it can be shown to other persons, and the algorithm will help us, to get the information to those that need it. I want to say a big thank you for you being on this call. Tomorrow is another episode, and I want you to watch out for it. 7 a.m. to 7:30, just 30 minutes training. Just that will help you to empower yourself for everyday living. Once again, it's your friend and partner, Olushola Popola. Thank you for listening. Have a pleasant day. Bye.
Waking up at dawn, light breaking through, chasing dreams, no time to lose. In this race we strive and grind, motivation fuels the mind. Gonna rise up, we won't fall, breaking barriers through it all. Step by step our journey's clear, success is closer, don't you fear. Challenges we face headstrong in this rhythm.